Hi, I'm Dr. Kenny Levine. Welcome back to Health Talk. I'm here with Dr. Gregory Albert. Welcome, Dr. Albert.
Thank you.
You are a plastic surgeon, is that correct?
Yes, I'm a board certified plastic surgeon, and just like you, I do patients anywhere from 3 to almost 100. But I do plastic surgery of the whole body, from head to toe.
Okay, but you have a unique niche in our community, don't you?
Yes, I do. I do cosmetic surgery.
Right.
But one thing we share in common, I do professional athletes. So I've done work. I'm the plastic surgeon for the Florida Panthers.
Right.
And which takes up a lot of my time when they're playing. But that gives me an opportunity to not only see physically fit patients, but also see some aspects of injuries, if you will, with broken noses and broken faces and putting them together, which then gives me insight to my cosmetic procedures.
You know, you mentioned we have something in common. Early in my career, I worked in an office with the team dentist for the Miami Dolphins. And it seemed to me that the bigger the guys were, the more anxious they were to come to the dentist. How do you find it with these professional athletes?
Some of the professional athletes can be like that. I have a big male population. It's growing. As the age group is growing, men are they're getting in tune with plastic surgery. A lot of the times they want to stay in the workforce longer. They want to look more competitive. They don't want people to kind of see that they look tired possibly. And so we're seeing more of this type of patients. So men, they're becoming more comfortable with coming into the office.
And they want to look more attractive to the opposite sex also, right?
And also in the dating world, as you had mentioned before, we're living longer, possibly more relationships. So men are having plastic surgery not only starting in their 30s and 40s, but they're having in their 60s and 70s. Usually the younger age group has liposuction. Another thing I do a lot of is gynecomastia, or breast reduction in men.
For men, right.
In Florida, it's hot. Lots of men wear shirts, those Tommy Bahama shirts that just don't look right when you have breasts.
Right.
You know, and then the older population, not only they don't like to play golf with the shirts that are tight once again, but they also don't like to go to the pool and have breasts.
Attractive, right.
And so in Florida we have a kind of a unique population.
So it's a niche that you may not have in Alaska, for instance.
Correct.
You know, I think I relayed to you before, I was at a hockey game many years ago, and I saw one of the players go down, and all of a sudden there was a pool of blood, and they came and they picked them up, and the blood spread all over the ice, and they picked him up, and he was holding his face, and then just a couple minutes later I saw one of the attendants come out looking, and he picked a tooth up from the ice and carried it in, and 10 minutes later this guy came out to play hockey. These are really tough guys, and they have a lot of dental issues. How do you find that?
Yeah, they are tough. They're extremely tough, and they actually make pretty good patients most of the time because they're very motivated to get back. Mm-hmm. For instance, when I do a broken nose or I do an oral reconstruction, that's fairly solid after about a week to 10 days.
Really?
So they can start skating, and they can get back to playing within 2 to 3 weeks sometimes. So it's really gratifying for me because they get back so soon, usually, and as opposed to if it's an orthopedic injury, for instance, an ACL or a broken bone.
They're out a long time.
They're out much longer.
Well, we'll talk about facial things because that relates to what we do. They all wear masks now?
No, that's optional.
Okay.
And they just wear either a half shield or a 3/4 shield.
What are the clear plastic things that you see? I've seen basketball players wear it where they have an injury and they wear this clear plastic shield over their face, so it makes them look like Mr. Sardonicus.
Right.
What is that? Is that just a guard for them?
It's just a guard to help protect things. Probably decrease the injury, but they would probably still be injured. So it might, in those sports, it might save from a broken bone. But when you have an ice cold puck coming at you at 90 miles an hour,
right?
I've had many injuries where it's almost a cut through the skin,
okay,
down through the nose.
We're going to get back to that.
There's puck in there.
Okay, we're going to get back to that in just a moment with Dr. Albert. It's Dr. Kenny Levine with Health Talk. We'll be back in just a couple of minutes. Thank you.